Welcome back to Good Morning Arkansas. I'm so happy to be joined by Dr. Talledo, who is a bariatric surgeon at the Bariatric and Metabolic Institute at the Arkansas Heart Hospital. And also joining us is Liz Bird, who was a patient at the Institute. Thank you both so much for joining me today.
Thank you for having us.
So, Dr. Talledo, I just want to start out with you. We'll get into Liz's story here in a second, but just talking about what y'all do there at the Arkansas Heart Hospital in the Bariatric and Metabolic Institute. How is weight loss surgery a benefit to patients?
Well, it addresses patients' weight, but more importantly, it addresses their obesity-associated comorbidities. So, for example, they have hypertension or obstructive sleep apnea, diabetes, reflux disease, and so many other conditions. By receiving this operation, we address the weight loss and improve or even cure other diseases.
So you're saying this can definitely improve the risks of other life-threatening diseases?
Not just that, we reduce the rate of cardiovascular diseases, and we decrease the incidence of different types of cancer in people. So, yeah, I mean, I'll even say we improve quality of life and add years to your lifespan. So,
oh wow, well, what options are available there?
Here we perform two surgeries: the laparoscopic sleeve gastrectomy and the laparoscopic gastric bypass.
So explain to me, what procedure did Liz actually undergo?
She underwent the laparoscopic gastric sleeve.
And what made Liz such a great candidate for this surgery?
Well, she had all of the indications to need this metabolic and bariatric surgery. And after going the pros and cons of each one of them and the associated inherent risks, which are very low for the surgery, this is a very safe surgery, we came to the conclusion that sleeve would be better for her. There are certain things that make a patient better suited to receive one over the other, and that is depending on patient's preference and also depending on the patient's comorbidities.
Okay, well, Liz, I kind of want you to talk to us about your story of when did you decide, like, hey, I want this surgery?
Yeah, so actually, I did not, when I first came to Arkansas Heart Hospital, I came to see a new PCP. And beforehand, I was worried about my weight. My highest weight was 305 pounds, which is a considerable amount for a girl of my age. And so I came to that doctor and I was like, I really want to focus on losing weight right now. And she recommended me for the Bariatric Institute. And I started looking into it and I thought it would be a great option for me.
If you don't mind you said a woman of your age, how old were you when you received the surgery?
So when I received the surgery, I had just turned 21. It was about 6 months ago. And, a lot of people tend to resort to this surgery when they feel like, they have a lot of comorbidities. They kind of like is their final option. But for me, it was kind of more like, I want to go ahead and lose weight now so that I can prevent having those comorbidities in the future. It wasn't a surgery to, kind of take my life back, but kind of more to give me a more productive life in the future.
How is your overall health after having this surgery?
Since having the surgery, my overall health has improved so much. I have great blood pressure now. I feel so much more energized every day. And honestly, one of the biggest things that has changed for me that I was completely shocked by was my mental health has improved drastically.
And maybe somebody's watching this and being like, well, if she did it, maybe this would be for me too. What would you just say to those people maybe curious or interested?
I would say that if you are interested in the surgery, you should definitely, research it, look up the pros and cons of it and see if you're a good candidate. And if you are, I highly suggest you do it. I have gotten to be so much more productive in my everyday life, as well as much more athletic. One comment that Dr. Talledo made to me right before I had the surgery was he wouldn't be surprised if I came in one day and told him that I was planning on climbing Mount Everest, which I laughed at the time. I thought it was a funny joke, but in reality, seeing how much more athletic I am now and how much more I exercise and how much more I enjoy hiking and nature and stuff like that, like, he's not wrong. So
that's amazing. I love that. Dr. Talledo, are you crying? Did that make you emotional?
Remember the exact, it took me back because it's right. It's right. You know, like what you say is very important to stress this. It is not the last resource.
Yeah.
It is not the easy way out. This is the gold standard of care for obesity and metabolic disease. This is the best treatment out there.
Yeah.
Well, Dr. Talledo, if somebody is curious or interested, what would be the best way to reach out to y'all just to receive more information?
No, they can visit our website at bmi.arheart.com, or they can call our office. And I mean, asking questions or coming to meet us is not like, by no means do you have to feel like you have to have surgery. You just can come ask questions and get informed.
Yeah.
Interesting. Well, Liz, thank you so much for sharing your story. And Dr. Talledo, thank you so much for joining us and giving us more information about this. Thank you for joining us today.
Yes, of course.
Thanks for having us.
We'll have more Good Morning Arkansas after the break.